Hi everyone, my name is Chanel Miller and I'm the National Officer of SCORA. SCORA is the Standing Committee of Sexual and Reproductive Health and Rights, including HIV/AIDS. Now today I'll be talking with you briefly about racial discrimination in medicine, specifically within sexual and reproductive health. So before we get started though, I think it's very important for us to recognize and remember that the current cultural context that facilitates this sort of racial discrimination is heavily influenced by the past. There's an enduring legacy of racism that is pervasive and that affects every single facet of life. Medicine is not spared. So in a broader sense, in the medical community, we are witnesses to the discrimination that exists, whether it be lack of representation in textbooks and research studies, or whether it be adverse outcomes for some racial groups as opposed to others. Like, we see the discrimination and the consequences of it. Sexual and reproductive health issues, not an exception here. A study coming out of the CDC where they collated information from 2007 to 2016 with regards to pregnancy-related maternal mortality showed the following. Black women as well as Native American women had higher levels of pregnancy-related maternal mortality when compared to other groups. Of note, Black women as well as Native American women over the years of 30, when compared to their white counterparts, had 4 to 5 times the risk of maternal mortality. Important to remember that race is a fundamental determinant of health status. How, you might ask? Because it influences social injustices. These social injustices influence health behaviors, access to healthcare, as well as the interactions with medical professionals once that healthcare is sought. Being in a Black majority country doesn't mean that these problems aren't applicable to us. They still are. The anti-Blackness still manifests in our context. Methods of segregation and discrimination rooted in class, colorism, are rooted in anti-Blackness as well, and those are present within our society. It's important for us to remember that we can't practice medicine in an insular way. Dealing with pathologies that present to us are important. It's important to have the medical knowledge, but of equal importance is to remember that, we're not just dealing with pathologies, but we're dealing with persons who are holistic and have several health determinants. The problems surrounding race-based discrimination in medicine are plentiful. It's important to remember them and check our own biases. Everyone deserves access to healthcare free of stigma and discrimination.